All right, good evening, everyone. We thank you for joining us tonight. You are certainly in store for a treat. We are elephant happy and hippopotamus glad that you've decided to be here with us tonight. Certainly, you could have been anywhere in Zoom world or anywhere uh, doing anything at this particular moment, but you've decided to join us. And in case those who don't know, my name is the Reverend Vernon K. Walker. I have the privilege of being the program manager at the Communities Responding to Extreme Weather. And we are one of the programs or one of the organizations that is responsible for bringing this robust program to you. We want to say hello to everyone in Facebook land and virtual land. Hello, hello. Thank you for joining us. Literally, you can be anywhere in the world, but you've decided to tune in here with us, and we are so appreciative of that. So, again, we're in store for a robust, intergetic conversation. We have very knowledgeable folks with us related to the medical field and extreme heat and the intersection between extreme heat and human health, etc. But I want to turn it over to our partner in crime, Andrew Sharp, who is the founder and the executive director of the Authentic Caribbean Foundation. We'd like to turn it over to you now to say a few words and to welcome everybody.
Buenos tardes, bonsoir. Good evening, everyone. This is Andrew Sharp. I'm from the Authentic Caribbean Foundation, and it was great pleasure to be on this distinguished panelist and to talk about something that is vital for our Caribbean American community and every community in general. Extreme heat, the focus of climate change that we're facing as we move and advance in the 21st century. The foundation is a 501c3 or focuses on our community, advancing our community and advocating for it. And as a foundation, we've been doing a lot of work in our field in providing information. Knowledge is power, and it is important that our community is updated with relevant information that is needed to assist them, because a healthy community and a sustainable community is what we're all about. And to ensure that we break down some of the barriers of the disparities that are facing our community. So it is really, really good that we here as one of the partners in the field, on the ground, doing the outreach throughout the state of Massachusetts, but primarily the city of Boston, to ensure that our communities keeping cool and understand how to keep themselves cool during this heat. So thank you very much, Vernon, for such a wonderful partnership and collaboration. And I look forward to many, many more opportunities like this. And I must say to all of my immigrant, Black and Brown, Caribbean American community, it is vital that we be involved. We keep our ears and our eyes open so that we can understand, learn what is available for us right here in this great nation of the United States. Thank you.
Thank you so much thank you so much for sharing and welcoming. If you are, we like to ask everyone, we should have talked about proper decorum, or maybe etiquette for this particular Zoom. If you're not speaking, we like everyone to mute themselves, and we, just to eliminate background noise. Well, before we go deeper into our program, I'd like to begin to show you how extreme weather is impacting Massachusetts, the greater Boston area, Massachusetts in general. We know that climate change is the greatest existential threat to human existence. We know that climate change has been happening since the Industrial Revolution. And particularly today, we're going to focus in on extreme heat because extreme heat is dangerous and it is deadly. So I'm going to share with you all my PowerPoint, if you will. And I want to just walk you through this. And then after we walk through this, then we are going to go and hear from some of the outstanding medical professionals that are with us to hear what they have to say and what they've seen, etc. But let's lay the groundwork, if you will. So to backtrack and to retrack, we are Communities Responding to Extreme Weather, CREW, in partnership with the Authentic Caribbean Foundation. CREW, for some of you that may not know, is a program nestled under the Better Future Project. The Better Future Project is an organization that works to build a powerful grassroots movement to address the climate crisis and advance a rapid and responsible transition beyond coal, oil, and gas towards a renewable energy future for all. We have 3 programs. We have 350 Mass, or 350 Massachusetts, Divest Education, and CREW. You may be wondering, well, what does CREW do? Well, I'm so glad you asked. CREW is what we do and who we are is a young grassroots organization that aims to build equitable, inclusive neighborhood climate resilient in New England, and through hands-on service, education, and planning. So we've been around for about 3 years, the program, but the organization has been around for almost about 10 years now, the Better Future Project. And we're located in Cambridge, Massachusetts. And what brought about the existence of CREW is the fact that extreme weather is happening and it's going to get more intense over time, and it's becoming more deadly over time. So when we talk about extreme weather or climate change impacts, what we're talking about is extreme heat, sea level rise, massive amounts of precipitation, etc. Particularly, that's how those extreme weather impacts manifest itself in New England thus far, and hurricanes from time to time. We have seen, I mentioned earlier, that this has been the wettest July. If you live in Massachusetts, this has been the wettest July in 100 years. So this is quite evident that climate change is real. New England is the only place I know, and I'm from Philadelphia, West Philadelphia, born and raised. That's where I spent most of my young days, similar to Will Smith on the west side, which is the best side. But New England is the only region I know where you can experience summer, fall, winter, and spring all in 1 week. And we know that the weather vacillates and the weather is up and down. And we see that in 1 week, you can experience many different weather that's typically associated with other seasons, such as fall and or spring or summer or winter, etc. But today, we will focus on narrowly extreme heat. I failed to mention at the beginning of this, that there will be a gift card to one person that can answer the question that we'll ask at the end of this. So we want you to pay attention throughout the Zoom. because you might have a chance to win a $100 gift card. So let's talk about heat for a second. We see that from the time frame of 1971 to 2000, there were 11 days of weather that was over 90 degrees. And the extra shaded box is weather over 95 degrees. So we see that in total, there were 11 days over 90 degrees. You see in 2015 to 2044, there's expected to be 31 days of temperature, and this is the current time frame we're in, being in 2021. There's expected to be over 31 days of temperature over 90 degrees. And we see in 2055 to 2084 that there is expected to be over 60 days of extreme heat. And just for full context, in case for some who don't know, New England, Boston experiences about 90 days of summer. So we're talking about from 2055 to 2084, a majority of the summer temperatures being over 90 degrees. And we can see that there will be over 60 days, almost 70 days really, of temperature over 90 degrees. Heat kills. Heat is dangerous. And I wanted to bring this into focus here by the National Weather Service. We see here that the average weather fatality, by different fatalities, we see, let me move this out the way here. We see that flood, lightning, tornadoes, hurricane, heat, winter, cold, wind, and rip currents. So by far, we see that heat is the deadliest of them all. So we see the 10 to 20 year average from 2011 to 2020, there were 94 deaths across the United States. This is just to clarify, this is across the United States. The 30-year average from 1991 to 2020 has been 138 deaths per year that is. So let me clarify, not in total, but per year. So 138 deaths per year over a 30-year period of 1991 to 2020 across the United States. When we compare that, and you'll see heat right there, when we compare that to flooding, for an example, the 30-year average for flooding from 1991 to 2020 is 85 people have died because of flooding. And a loss of any human life is devastating. And we ought to understand that, extreme weather is dangerous and deadly, and the heat waves send hundreds of people to the ER every summer. There was a report released, and we'll include this in the follow-up email. There was a report that was released by WBUR in 2019 that said that Boston could feel like Alabama by 2100. This is atrocious. So when heat happens, people suffer, particularly the most vulnerable among us. And there's another ripple effect. And that ripple effect is known as urban heat islands, or it causes urban heat island. For those who are not familiar with urban heat islands, neighborhoods with little tree cover, urban heat island is the neighborhoods that have little tree cover, few grassy areas, and a lot of concrete can be as much as 15 to 20 degrees hotter than surrounding areas. So for an example, in Dorchester, Ashmont area and other parts of Dorchester, and I'll show you all the map in the next slide, we see that there are a lot of urban heat islands in Dorchester. And that's why we wanted to reach out to the community in Dorchester. We wanted to reach out and let folks know that extreme heat is coming and it's dangerous and is already here. It's going to get more intense, but it's something we can do about it. We'll get to that in a little bit. So the urban heat island effect amplifies a heat wave's already oppressive temperatures. So it exacerbates a heat wave. So if it's a 95 degrees day and you're living in an urban heat island such as the Ashmont or Cottman Square, this means that it could feel anywhere between 100 to 115 degrees if it's a 95 degree day, which is very hot. So I'm going to read again. The urban heat island effect amplifies the heat wave's already oppressive temperatures. Areas with a lot of asphalt, buildings, and freeway tend to absorb the sun's energy and then radiate heat. But check this out, y'all. Areas with green space, parks, rivers, and tree-lined streets absorb less. So if you, historically in urban areas, there's much more concrete. When we think of New York and Philadelphia and Boston, Chicago, etc., these are cities that have a lot of concrete and a lot of buildings, and this creates the urban heat island. But when we think of areas in the suburbs, for an example, it's less of an urban heat island because there's more green space, more parks, more rivers, more tree-lined streets. So for an example, you think of some place in Boston like Austin. Well, you have Austin is near the Charles River. You also have a lot of parks in Austin, etc. So it's less of a heat island than a place like Ashmont, where it's much more concrete and buildings, etc. So y'all, I want y'all to check out this map. So this is Boston. You can see that, like here at Ashmont, if you look at the bottom of the map, you can see that it gets really hot. You can also see, in the parts of the south end here, that is like darker. You see Chelsea up there. Chelsea gets pretty dark. You see a little bit of Somerville, Kingbridge. So obviously, the more shaded the area, the more darker the area, the more hotter it is. You see Logan Airport, which is East Boston, that gets pretty hot. And then, so these are things where with these urban heat islands are normally in E&J communities, environmental justice communities, which historically have been communities of color, communities of low wealth, coastal communities that feel the brunt of climate change or the effects of climate change. Because we know that climate change doesn't affect us all the same, but it disproportionately affects community of low wealth and low income. And it historically affects coastal communities, etc. And as climate changes, and if we don't limit the amount of carbon in the air by 2030, scientists have said, and according to the 2018 report, the UN report, that there will be much more extreme weather, or the weather will be much more intense and much more extreme, pitting 10 million, and there's a study that says that put 10 million homes in Massachusetts at risk from being destroyed because of extreme weather. So I wanted to show y'all that about these heat island. You see Franklin Park. See, look at Franklin Park for an example. The reason you see that is blue is because there's a lot of trees, and it absorbs the heat. And it's a lot of park. The Franklin Park is a big park. So just to show you the difference here. So the question is, what are some of the psychological? Oh, and also, before we get into this, Boston has been ranked number 6 as the sixth city in America that's tied with Miami and another city, perhaps Chicago, where it's a city that suffers from the most heat islands. It's the 6th city in the United States, tied with, I believe, Miami and Chicago. But we'll send that link in the resources to send out. So there are some psychological impacts that happen when there is extreme weather. So for an example, up to 45% of adults and 45% of children suffer depression after a natural disaster. 49% of Hurricane Katrina survivors develop an anxiety or mood disorder. 1 in 6 develop PSTD, post-traumatic stress disorder. Suicide and suicidal ideation more than double when there's an extreme weather event. Outside of the United States, the suicides of 60,000 Indian farmers over the past 3 decades have been directly linked to climate change. An increase of 5 degrees Fahrenheit or 5 degrees Celsius, 9 degrees Fahrenheit on any given day was linked to 335 deaths. So oftentimes when it's hot outside, you see there's a correlation between crime, there's a correlation between mischievousness, there's a correlation between violence because people are aggravated, and sometimes the heat can exacerbate mental health, already pre-existing mental health conditions, etc. But here's the opposite of this here. Well, here's some more information on that. The crumbling community effect. After a climate event or resulting in displacement, people experience a diminished sense of self, difficulty relating to others, diminished social interaction and socialgia, the loss of sense of place, solace, and security tied to one's physical environment. Community impacts include domestic abuse, child abuse, and violence, e.g. assault and civil conflict. Economical insecurity and physical damage are other potential effects. So when we see that there's a climate event such as a Hurricane Katrina or Hurricane Sandy that hit the eastern seaboard in America in 2012, or Hurricane Duran that hit the Bahamas in 2019, there's a climate event that results in that results in displacement, people experience a diminished sense of self. And also, there's community impact. Domestic violence goes up, child abuse goes up, violence goes up, etc. So there is a correlation. However, the antithesis of that, or the opposite of that, is cooperation. Cooperation looks to establish social ties and connections within communities with community members. This helps withstand and it changes and encourages adaptation. So the question is, and then I'm almost wrapped up here, and then we will go to the next portion. What does Crew do about all this? Well, we have community teams. We have one in Somerville / Cambridge. We have a team starting out in Amherst, and pretty soon Western Mass. And what these teams do is these are neighborhoods neighborhood community members. These are community members in a neighborhood that come together and are interested in building social resilience, interested in building social ties, because we believe at Crew the greatest way to become climate resilient is through social resiliency. So the best way to survive a heat wave and to survive a flood is to make sure that you are connected with people. There was a heat wave in Chicago in 1995 that killed 739 people. And this was devastating and dangerous. Killed 739 people. And the author that put a book out, Eric Klingberg, The Heat Wave. The name of the book is Heat Wave 1995 Autopsy of the Chicago Heat Wave. And he talked about, he did a block by block analysis, and he talked about those who were connected and those who had people doing wellness checks on them were likely to survive. So this was important, to be connected. And this is what we try to do. If you're interested in starting a Crew team in your community, please let us know. We can work with you. We could share the tools with you to build those relationships. We also have Resiliency Hubs, which we won't spend a lot of time on, but it is on our website. Resiliency Hubs are organizations. We have about 70 of these actually, 69 in America and 1 in Canada, and about 34, 35 here in Massachusetts, and with several in Boston. And these hubs are libraries, faith communities such as churches, etc., that want to become a hub. And the way they become a hub is they express it to us, and then we send Climate Resiliency Hub window decal. We send a lot of information on how to prepare for this, prepare for climate emergencies, whether that's frostbites, whether the heat stroke, etc. And they agreed to host an event at least once a year. So around climate resiliency and educating people and sharing with their community members, this is how you can adapt to the challenges of climate change, of heat waves, or etc. Sometimes it'll be a book discussion, etc. So the key is making a plan. So preparing for heat, and this portion is almost done. You want to cover windows with drapes, shades, or aluminum foil covered cardboard. You want to find a cool place in your community, maybe such as a library, but we know that COVID has certainly interrupted that in many different ways in terms of places being open to the public. But as more and more people are becoming vaccinated, more and more things are opening. Never leave a child, and a lot of this seems like common sense, but we just emphasize that anyhow. Never leave a child, adult, or animal alone inside a car on a warm day. Avoid exercise on an extreme hot day. Wear loose, lightweight, light colored clothing. And you can see this all at www.ready.gov heat. Check in on your neighbors. If you know that there are some elderly folks in your community and you know they may be empty nesters and their kids may live in different states, or you know that that this person is maybe not have an AC unit, check in on them. See how they're doing. Maybe if you feel comfortable, maybe if you can offer them a ride to a library that's open during the day that provides to allow people to come in and be cooled down, or maybe if you feel comfortable, depending on your level of the relationship with the person, maybe you can invite them to your house if you have central air or AC, because we know that ACs are very effective in keeping the home cool during extreme heat. And finally, this is our chill out heat relief bag. So these are sold. I'm going to tell you what's in them. These are sold at Walmart, and these come with water bottles. These come with different pieces. There's 21 pieces to treat relief for heat exhaustion. It comes with thermometers, cool patches, etc. And these are only $14. We're actually giving out 100 of these in Brockton later this summer. We have ordered 100 of these, and we will be giving these out. And if you have to go outside, and if these are designed for people who have to work outside or do sports activities outside, etc. Even it will help you not experience the worst of heat exhaustion. So I'm going to stop sharing my screen, and I am going to turn it over to Dr. Karen Solomon, and we have and she has a team with her. Maybe they can introduce themselves, and we're going to turn it over to Dr. Karen Solomon to share with us. And I'm going to introduce her actually. She is a doctor and a professor and I'm looking for your bio here.
I can introduce myself. That's okay.
In fact, you can probably do that better than I can. But I'm going to turn it over. But yeah, she is a doctor, as a professor at Harvard Medical School, and I think she's also a doctor at Brigham and Women's. And we are elephant happy and peacock proud to have her here on tonight. And we're going to turn it over to you and to some of the team that you have brought with you, respected professionals in their own rights, and maybe they can introduce themselves, and we'll turn it over to you all at this moment.
Vernon, thank you so much. So actually, do you want, Liz and Raquel, do you want to just introduce yourselves quickly, and then we can all be chiming in?
Raquel, you want to go first?
Sure. Hello, I'm a nurse practitioner. I work for Mass General Hospital, and I definitely see the effects of climate change on health with patients, and happy to learn more tonight also from hearing everyone's experiences.
Hey everybody, I'm Liz. I'm a general surgery resident with an interest especially in climate change and especially extreme heat. From a surgery standpoint, not only am I interested in how heat affects my patients, but I'm also interested in how we can make the delivery of surgical care have less of an environmental impact. And so I'm excited to talk with you guys about strategies to deal with heat as we move forward tonight.
Terrific. So I was just going to do a quick kind of general review, and then the hope is you guys might add, and maybe some of you will have questions, which would be terrific. But Vernon, thanks so much for the background, which is so important. And I've noticed going on in the chat a discussion about fossil fuels. And you know, again, I think you all know this, but I just want to lay out up front that by burning fossil fuels, along with some other activities related to agriculture, et cetera, we are basically putting lots of greenhouse gases into the air, and they are trapping heat. And that's leading to the problems that we're talking about. So beyond, you know, kind of dark curtains and staying out of the heat, which I agree with all the advice, but, you know, ultimately we have to get to the root of this problem, and we have to dramatically cut and then eliminate our use of fossil fuels and switch to renewable sources. But right now, let's focus on the health issues related to extreme heat. So what's really important to emphasize is what Vernon has already alluded to, which is that extreme heat is very dangerous for health. And it acts in several different ways. So just one, you know, general point is sort of acute heat illnesses. And typically those are called heat exhaustion or heat stroke. And those are immediate acute effects of heat, where you're outside in, you know, or inside in a hot environment and you feel unwell. So heat exhaustion, people don't feel well. They feel nauseated. They might feel lightheaded. They're often very sweaty. If you experience that, and ideally by following some of the preventive measures, you know, you can avoid that. But if those symptoms occur, the recommendation is just, you know, get somewhere cool, drink fluids, loosen your clothing. You know, you can generally take care of that. I want everybody in the audience just to be very aware of heat stroke, which is life-threatening. And in that situation, your body temperature actually rises. So over 103 degrees, sometimes people actually stop sweating. So their skin is actually quite dry, but they feel very unwell. They can become very confused. People can lose consciousness. And if you were to, you know, see someone, often if you're in that position, you know, people are often not aware of how ill they are. But it's very important to recognize that if you are with somebody who is experiencing any of those kind of unusual symptoms, that is a health emergency. You need to call 911. You want to put towels on them or get them in the bath if that's possible, and cool them down as quickly as possible. But you need emergent help to save their life. And wanted to cover that one up front. But importantly, heat also affects health in a lot of domains that people often don't think about. So we know, for example, that breathing can become more difficult when it's very hot. Okay, so levels of ground level ozone, which is basically smog, increase in hotter temperatures, and particularly people with underlying respiratory conditions or heart conditions can actually have marked difficulty breathing. People have heart attacks or strokes when it's extremely hot. That risk is increased as well. People's kidneys can begin to not work appropriately. People can form kidney stones. The mental health effects have already been referred to by Vernon, and I would just emphasize them again. We see people having really a variety of mental health problems, and particularly people with underlying mental health conditions. You know, you can see tremendous worsening in the setting of extreme heat. It's just agitating, it's depressing, it's anxiety provoking. So being aware of that. We also know that a lot of medicines people take for diseases can affect their ability to deal with heat. And that's something to be aware of if you're on certain blood pressure medications, diuretics that make you lose fluid, laxatives that also can cause fluid loss, antihistamines for allergies. Those can all make somebody a setup for illness related to heat because it compromises the ability of the body to handle it. And then finally, I want to add that for women who are pregnant, there's also a substantial risk, that there's a risk of preterm labor associated with extreme heat. extreme heat exposure very early in pregnancy has been linked potentially to birth defects. So I think there are just a number of organ systems that we need to be thinking about and recognizing that as these temperatures that we're being exposed to are rising, we need to protect ourselves acutely, but then we also need to get involved as much as possible in actions that are going to, again, get to that root cause and affect, the burning of fossil fuels and such that are just making this problem worse and worse over time. So I think that's my initial review. I want Liz and Raquel to weigh in as well.
Yeah, I can jump in and reiterate everything that Dr. Solomon has said, and tying it back to what Reverend Walker referenced, the social resiliency and checking in on your neighbors, because the people who have the most and highest risk of all of the underlying diseases Dr. Solomon highlighted are our elderly neighbors who have developed over the course of their life various problems with their heart or their lungs, especially if they smoked throughout their lives or something like that. And they're often the ones who have the least knowledge and least connection to abilities to get to a cool library, access to things like Uber or Lyft or their own car, often don't have air conditioning. And so being sure that you're aware of those people in your family and your social groups is the easiest first step toward building that social resiliency Reverend Walker talked about. And as Dr. Solomon said, it all comes back to activating our community and highlighting how important it is in the long term that we get off fossil fuels, because we're just making this problem worse and worse for the next generation. And the important part, the reason that I think a lot of us are here, is the impact is not fair. It is highest on our poorest and most minority, communities with the most minorities, because of historical racism and the way that our social systems have been built and the way that our infrastructure is now aligned. When we look back historically and identify the communities that are at highest risk, as Reverend Walker did on that map, it's the same communities who decades ago were redlined and have been now become these urban heat islands. And so, as he's highlighted, this risk is bad for everyone. It's bad for old people across the country. It's bad for pregnant women across the country, but it's exacerbated or worsened for those who live in these low resiliency communities. And that's just, as a physician, something that I don't find to be fair. And I want to do as much as I can personally to get involved and help my patients deal with this. And then on the long term, as she said, try to get off and get away from the source of the problem.
Thank you. Raquel?
Yes, I agree with everything that everyone is saying, and I would like to say that I also work in COVID right now on a COVID hotline. So of course it ties in when I'm listening to everyone, especially right now. This is such a complex problem tying in with elderly people also who are either you have people who are isolated due to COVID still. I still talk to people who are afraid to go out in public. They don't want to really see anyone or do much. And now if they're afraid of the heat or are unaware, and it's important if you know people around, like in your neighborhood, like they were saying, and trying to build those relationships, checking in on people if they need medical help, especially if someone's having difficulty breathing or any of these symptoms, if they're suffering from heat problems on top of potentially COVID or other issues as well, it just complicates things even more. And it creates a whole lot of anxiety and stress as well that we're seeing. And the rates of depression, isolation, and all these things from the pandemic have increased as well. And then with people not being able to have family around to visit and check in on them, it's a complex, complicated issue, I would say, particularly right now with these two huge problems hitting the world at once, and equally important. So I think it's a good idea to just make sure we all have a network and that there's someone around to talk to and get you medical help if needed, or like they were saying, just get you some kind of help in air conditioning if people are comfortable, getting people the care that they need. And the mental health piece, I agree, especially with elderly people, but also with young people too. I think it's important. So thank you.
No, that's great. I'm glad. I think the COVID point and the sort of extra isolation point is really critical, because as you both have said, and Vernon, you were mentioning, I mean, it can't be estimated how much, and it's been across the Chicago study that Vernon mentioned, but also, you know, many other studies. If you look at people who are alone, you know, particularly elderly people who are alone, you know, die of heat, where it would be something that could completely be remedied by simply being able to recognize that person's in trouble and you know, get them to a cooler place. So and I think, you know, COVID has complicated. I guess I'll just put in a plea also if anybody's not vaccinated, because I think, you know, last summer there was just an enormous worry that you couldn't even have cooling centers function well, because right, everything was closed that was public and people were afraid to be in a space with other people. I think the more people who are vaccinated, obviously, the safer we are, you know, coming into common spaces that, you know, is necessary sometimes to deal with these climate emergencies. And so that's certainly not the only reason to get vaccinated. There are many, but I think at least we could sort of have control of that aspect of it, you know, with vaccination. And obviously Massachusetts is doing relatively well, but we can all do better.
Thank you all. Maybe I could throw out the first question. The first question I have, what are, and all three of you can answer. Okay, we're gonna mute somebody. Okay, that's all smooth and cool. What has been some of the lessons that you've seen during the COVID crisis that we could apply to dealing with the climate crisis? You could take some time to think about it, and all three of you can answer if you like. But just curious to see, you know, what are some of the lessons that you see that we've learned from the COVID crisis that we can apply to the climate crisis?
Yeah, so I'm happy to start that one, and I think we'll probably all have a lot of thoughts on this one. But I think we've you know, certainly seen the disproportionate effects, and Raquel, you were referring to this, Liz, you are as well, right? So the disproportionate effects of both conditions on certain more vulnerable communities, and the need to really pay attention to that and change our whole structure of, you know, sort of access to health and services, et cetera, because it's been horribly unfair and just kind of shocking to look at those disparities. And I think they both had that effect. I think we've also obviously learned what happens when people don't listen to science, right? So you know, we've known that the climate crisis is brewing for decades, and particularly our fossil fuel company scientists knew it before the rest of us. And yet we have been painfully slow to do what is necessary. And obviously COVID was operating and is operating on a different scale, but sort of that time, I'm sorry, that, you know, that the sort of time that passed between kind of understanding some of the things we needed to do to protect ourselves, and, you know, what is not happening in certain places because of misinformation and misunderstanding of the science. And so those are two big parallels for me.
I'll jump in, and one thing that is very specific that I think about for similarly how certain communities are susceptible or at higher risk for COVID in the same way they are to climate change. One thing that it's made me really think about is how important your actual home is to your health. And sometimes we overlook those interconnections between different facets of our life. And we think our housing, you know, and potentially our electricity, access to electricity, and those sorts of issues can't be related to health. They're related to our finances, and they're related to, you know, our long-term maybe goals and plans from a financial standpoint. But they're actually quite intertangled, because folks who lived in very cramped communities ended up transmitting the virus much more quickly within those kind of cramped spaces, because you can't separate and you can't isolate once one person has COVID. Similarly, people who live in homes that are older and don't have appropriate insulation or don't have air conditioning are at much greater risk to have issues with extreme heat than those who have more modern homes. And oftentimes, sadly, we see that those who are living in some of the more cramped conditions are also homes that are not up to code, not insulated, the most susceptible to heat. And that's a connection that even as physicians and healthcare providers who are trying our best to advocate for the health of all of our patients across the city, we don't necessarily make that intellectual connection and talk to our patients about, is your home ready for these kinds of health issues? And so thinking about that in terms of how you can optimize your health and advocate within your own community to make sure that infrastructure is up to date is certainly helpful. I know that that's a bigger community issue and not a one-on-one type of solution, but it's something that as we all work together to target this problem needs to be kept in mind.
Thank you. I just have a little bit more to say. They've said so much that's so great that I agree with. I personally also, I think I work on a COVID hotline, as I mentioned, so I take a lot of calls, mostly obviously on COVID, but this issue of the isolation and things has made me think of the climate change and the extreme heat we're experiencing right now in Boston, as well as these rainstorms that are something else too. I think when I'm listening, I would say the most important point is I receive a lot of calls about COVID from the beginning. I've started in March of 2020 on this hotline, and I order testing, and I have helped with the vaccination rollout as well, and the calls on reactions and concerns with vaccines. So I've talked to thousands of patients, and I agree with Dr. Solomon about the misinformation. I can't emphasize enough that it's heartbreaking to hear just these stories that are put out there. And I'm not talking about fears. I'm talking, with conspiracy theorists and things. I personally receive calls at the hospital of people trying to convince me of things that factually aren't true, and it can be really challenging for us as healthcare professionals, where we're really here to get the information out to help the public, where it's not political. We're not at all trying to make this political, and I'm sure everyone on this call has heard this already, but really from the bottom of my heart, it's when there's a public health crisis like COVID, and as well climate change has become one, it's just so important to listen to the science, like Dr. Solomon said, and to hear the information and realize that the healthcare professionals truly are here to help and give you advice or tips. And I know a lot of people have social media and things, so it's easy to kind of be clicking around and certain things come in, but it's good to have different trusted sources. And if you're following the CDC, it's a good source, and hospitals are a good source, just to listen to professionals kind of giving that advice and paying attention to those symptoms of what happens, when someone is overheated or suffering from any kind of health crisis from this, particularly the heat stroke. And it can happen to younger people too. And I think it's important to just look out for that and try to help people. And just in general, I guess I'm just trying to promote following the science and hoping that everybody is.
And now everyone on this call, I'm sure before this even, but has some amount of information that the general public really doesn't have. And community members and your friends and your family often trust you more than they trust some random physician or random CDC official they don't necessarily know. And so, you have your own agency to share this important information as well. And as Raquel said, it's about getting the correct information out there.
In that regard, there are a couple of comments in the chat, and Vernon, I don't know if we want to go to some of those questions or comments. So should I pick one out?
Yes, yeah. If you want to tackle, I think there's some good questions. Yeah, we'll tackle a couple. Yes, please.
Yes. Okay. And I'm just going to tackle this one quickly, and anybody else may want to join, but there do seem to be questions around the COVID vaccine, and just because it's so topical, even though I know our focus here is extreme heat, I do want to sort of answer this, that there's a tiny number of people that for various health reasons, cannot get the vaccine, but it's very uncommon that people can't get the vaccine. And I know there are certainly a number of people who sort of want more follow-up, to feel like they know that it's safe. And I guess what is just really, really important to emphasize is that, so there were two really, there have been multiple well-done vaccine trials now, but, for the Moderna and the Pfizer vaccines, this also holds for J&J, large trials showing incredibly effective results. Okay, so we're talking about, sort of 95% protection. And at this point in the US alone, it's something like 160 million people are fully vaccinated, and adverse events are extraordinarily uncommon. So people feel not well, sometimes right after they get the vaccine for 24 hours. But in terms of sort of longer term adverse events, they are so rare relative to the risks of COVID. And so I just think it's really important, to understand that although the vaccines went through so quickly, that I think it was unnerving for a lot of us. Are we going to have sort of good safety data? There is just a compelling body of evidence right now that they're very effective. Now, the more people who get vaccinated, the less we'll have to worry about these variants popping up, to which over time, the vaccine, it may not work as well for those. The ones that are circulating now, we still think it works very well. But so I just want to put out there that, there is sort of a lot of evidence, even though it hasn't been around that long. And, it's always wonderful to have more, but it's sort of balancing the risk of getting COVID and transmitting COVID to people you love, and having them become very ill, versus, the vaccine. And I think all of us, I know that all of us believe that sort of the benefits of the vaccine just enormously, outweigh potential downsides. I don't know if you guys want to add to that, and then we can go back to heat.
Yes, I completely agree with Dr. Solomon. Like I said, I've been working in COVID, and the risk is, so the risk when you first get the vaccine of having a side effect right then in the first 15 to 30 minutes, you're monitored. And if you were to have a reaction right then, a medical professional will help you. If you're nervous, you can always have the vaccine at a hospital or clinic if you want, more medical professionals around, or if you feel more comfortable with an emergency room right there in case you had, this rare reaction. But that is rare. That is very rare to have that kind where, again, we would treat you, I've worked in the vaccination clinic as well. We monitor the patients. We'll give them Benadryl or epinephrine or something if needed. Nobody passes out and dies right after. And that might almost sound comical to people, but people actually think that could happen. And don't be embarrassed if you've heard that or think that. I've had a lot of calls on that, but nobody just passes out and dies right after they're having the vaccine. If someone was having a reaction, we would treat them. If someone needed to go into the emergency room or something as well, that's very, very rare. So that's in the first initial 15 to 30 minutes. And then later, having this kind of a reaction you're hearing about, a rare blood clot or the heart inflammation is also extremely rare, like Dr. Solomon said. And the benefit of getting vaccinated completely outweighs the risk statistically if you look at it, and that you're not spreading this terrible disease to people. If more of us are vaccinated, there's less of us to worry about getting COVID, which certainly can make us very sick and make us drop dead. It's just very important. It's very important, particularly right now, for us all to try to do our part and get vaccinated, particularly I would say around here with things reopening and everyone's taking their masks off. And we're all getting more comfortable with that. So that's just my spiel.
I was going to say, that's great. That was really helpful. I want to actually touch on the question about heat-induced asthma, because yeah, so absolutely, in extreme heat, people who have underlying respiratory conditions like asthma or chronic obstructive lung disease or whatever, it is absolutely possible and well recognized to have that exacerbated. The other sort of piece, and it relates to climate change as well, is often, when in these seasons where, there are a lot of allergens, pollen, et cetera, around, and there's more of that because of climate change. I think you all know that. So pollen levels are higher. The season is longer, and then the plants in the setting of more carbon dioxide are just making more pollen. And that often precipitates asthma exacerbations. And then sort of that combination of that with extreme heat, it can be very, very challenging for people to handle. So that is a thing. Trying to look at other questions. Somebody brought up wildfires, which I think is also a really important issue. And obviously we've been fortunate in being relatively spared so far for now, on the East Coast, but absolutely, I mean, so in the setting of these drought conditions that are going on, which again relates to climate change, there's sort of that much more of a propensity for wildfires. And absolutely what happens is there are enormous levels of air pollutants. So like particulate air pollution is at levels like that we just don't see otherwise. And that likewise is causing tremendous respiratory and cardiovascular complications.
I have a question, Karen, and the panelists. How do you see the heat affecting food security?
Good. Somebody else want to take, I mean, I don't want to monopolize. Liz.
Sure, absolutely. So that's a complex question and a very important one, because as you highlighted, I think it was maybe you who put it in the chat, as globally the climate warms, which is why we've in the past called it global warming, the places that we currently grow large amounts of crops for big populations of people are starting to change, and our land is becoming less arid or less able to grow the crops that we rely on. And as that shift happens, certain foods are going to get more expensive, harder to grow, and the access to healthy foods in communities that already lack it is only going to go up. And so right now, what we kind of worry about in the immediate sense of these heat-induced events for your health personally are really important in the acute phase, as Dr. Solomon said. But you make an excellent point that yes, thank you for clarifying, less arable. So when I said more arid, it means drier and worse for crops. And less growing. But, like I said, there's two ways to think about this heat problem. The immediate risk to you, which we really want to communicate so that you can be safe in the short term, but then the longer term risk to our food stability and our access to healthy foods, which we could go into a whole another hour of lectures about why healthy food is really important to human health. But I'm sure that a lot of folks already know about that.
Thank you.
Yes. Well, we're just a few minutes past the 7:30 mark. However, we started a little late. Just wanted to maybe see if there's some final thoughts from you all, and then we'll go into the raffle, and then the program will be closed. But just wanted to open the floor to see if there's some final thoughts. This has been very thought-provoking. This has been very intriguing, and wanted to open the floor to see if there's some additional last thoughts.
I have one last thought, actually, of everything kind of tying in. I would say in my line of work, I think we're hearing all these different symptoms that people are talking about between the heat and COVID and things. And I'm just thinking, again, as people are, I said before, taking their masks off more, but there's an increase in other viruses as well, because we're all now taking our masks off more around people. And with that, there's also these allergies you're hearing about, symptoms, as well as climate change, and it all tying in together, as we said. But what's interesting and can also be kind of scary sometimes, I think, for any of us as a patient, when we're experiencing symptoms and we don't always understand what that is. So I would just say, if you're not sure, if you're starting to feel some symptoms, it's always good to check in with a medical professional. If you have a primary care, it's good because sometimes these symptoms might seem mild and they can quickly spiral into something else. And that's what typically happens with these severe situations. It's someone who thinks that they're okay. And I'm sure you may know someone. I know several people personally. It's, they just had a little bit of a mild symptom. They weren't really worried about it. And then you hear that they passed away, in their sleep or something and then everyone says, oh my gosh, I wish I got them help, or I wish I did this or that. And it just takes that phone call or take them into the emergency room if someone can't breathe, and just kind of evaluate, what are these symptoms? Is this something I need to worry about or not?
I'd like to, for my final kind of thought, build on what Raquel said and try to transition it into a positive note, because we've talked about a lot of scary things, both from the individual level and from more of a community level. But I really do want to tie back, and not that I'm beating a dead horse, but I think Reverend Walker's point about social resiliency was so important and so on key, and encourage and both thank you for being here and congratulate and respect you guys for taking the time to learn with us in this discussion, and highlight that in these scary times, we all have individual agency to take care of ourselves with more, now that we have more information, but also to spread the word and to help others understand these issues, because you guys are way ahead of the crowd in just understanding that climate change is related to health. Most people don't even make that connection, and starting to spread that word and help people understand how things like heat and heavy rains and wildfires and are connected to heat stroke, to the risk of heart attack, to the risk to our food systems. Having those kinds of conversations can go so far, and you guys have that agency, and I don't want to belittle that. I just want to encourage it as a positive note to end on.
Great. Liz, I'll add to the same, because I want to say there was one question early in the chat that we didn't come back to, but when Reverend Walker showed the what we're expecting with heat, and the question was like, okay, is this if we do something or if we don't do something? And I think it's just a critical point. So it's like, you can definitely take proactive steps in terms of sort of avoiding extreme heat. Hopefully you can get an air conditioner if you don't have one through this crew program, or know that you need to, go somewhere that's cool in that kind of weather. You can drink fluids, etc. But also, if we kind of are coming together and working, and we can change policy, the number of extreme heat days will be dramatically lower if we make these changes. So there's agency in that regard as well. And I think that's critical.
Vernon, I have a last point to say to everyone that is viewing. We say in the island, prevention is better than cure. So preparation is the key, and everyone should take it seriously and prepare themselves. Prepare for everything. I mean, we had a pandemic. How are we preparing for that? Are we preparing for all of these things? Because as we move forward, and we might say that hurricane might not affect us, but it does. Look at what New York had with Elsa and so forth. So preparation is the key. Preparedness for what is to come. Are we prepared? Thank you.
Thank you all. Thank you all for sharing, thought-provoking thoughts and very riveting conversation. Well, as we come to the close of the program, as we mentioned, we had a raffle, and one person will be able to win a $100 gift card. But we would like for you to put in the chat. Actually, can we put in the chat the question that someone can answer, and the person that comes closest to the answer will be or if the first person that we see with the answer will be the winner, and then we will follow up with you to get you that gift card. So if we could put that question in the chat. So remember earlier when I went over the charts and Someone said 64. Okay. Remember when earlier when I went over the charts and I was saying, okay, let's pay attention here. If there's the folks want to put in their numbers, and then I'll show the chart. I'll show the chart again. In about, we'll give folks we'll just give folks a minute to put your number in, and the closest number that comes to it, we're going to call it out. And I'm going to show the chart again. I'm going to show the chart. I'm going to show this chart again. We'll give it just about 10 more seconds. All right. So we have some numbers here. So now I'm gonna go back to the screen share so people can see. We'll give it a final 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And so what we're going to do is we're going to pull it up and show everyone again the map, and then we're going to go through the chat and see who was the first one to put that number there. So we're going to go here, and then I'm going to show you all. So the answer is 31 days right here, according to this. 31 days. So now we're going to go to the chat and see who was the person closer to oh, I have to stop sharing my screen. First one to pit 31 or closest to 31. So we have 30, we have
Kitty.
we have 31. Katie, okay, you have it. As we're going down here, you see 29, 33, 31. Okay, so Katie, we will follow up with you. You are the winner. As a matter of fact, if you could Slack us, if you could put in your email, we have it registered, but if you can send your email in the chat, we will get that to you. So please do put your email, and we'll follow up with you, make sure you get that. So we have several other events. We have an event on July 29th as we come to a close. We have July 29th. We will be doing an event. We will be sending an email to you all who registered. The location will have food there. It'll be an in-person event, social distance encouraged. We'll have some, I think we're going to have some Caribbean food there. So it's going to be dynamite. We're going to also have an event on August 26th, because this particular event is the first event in a series of events. So August 26th, that we're still nailing down that location. We will get that information, and we have all your email because all you registered. So we'll send that out as we have our email list. Also, we will have one other virtual event on, I believe, September 1st. That'll be our wrap-up event. And we will share that video, and we'll also try to video the ones in person in case folks can't make it. So I want to thank you. All our hosts, all our speakers rather. Thank you so much for sharing some insightful information. Thank you to the Authentic Caribbean Foundation for helping co-host this with us. Thank you all on Facebook land for joining us for this, as we mentioned earlier, this very riveting conversation. And there's more to come. We will continue to prepare people. And we look forward to seeing you. We want you to stay safe and stay out of harm's way. And we will see you soon. So we're going to stop the recording here.
And keep cool. Keep cool.